Hello guys, welcome back. So let's do another 50 questions from gynecology non-stop. If you have not subscribed my channel, so please do it. BCZ, you are going to learn a lot in next 20 minutes. So question 1. A prima gravida at 20 weeks complains of swelling in feet, blood pressure 120 by 80, no proteinuria. What is this condition? A. Pathological edema. B. Normal dependent edema. C. Severe preeclampsia. D. Renal disease. Answer. Normal dependent edema. Mild pedal edema without hypertension or proteinuria is physiological. 2. A woman is diagnosed with complete placenta previa. Which delivery is safest? A. Vaginal delivery. B. Forceps delivery. C. Caesarean section. D. Assisted breech delivery. Answer. Caesarean section. Placenta previa requires caesarean section to prevent hemorrhage. 3. The first sign of ovulation on ultrasound is A. Disappearance of dominant follicle. B. Endometrial thickening. C. Presence of corpus luteum. D. Multiple small follicles. Answer. Disappearance of dominant follicle. Follicle rupture indicates ovulation. 4. A patient at 36 weeks has sudden rupture of membranes with prolapse of cord. What is the first action? A. Push cord inside. B. Keep patient in knee chest position. C. Start oxytocin infusion. D. Prepare for vaginal delivery. Answer. Keep patient in knee chest position. Knee chest position relieves cord compression. 5. In ovarian cancer, the tumor marker commonly used is A. California 19.9. B. California 125. C. Alpha fetoprotein. D. HCG. Answer. California 125. California 125 is elevated in epithelial ovarian cancers. 6. A woman at 12 weeks pregnancy has painless bleeding per vagina. Cervix is closed, fetus alive. What is the diagnosis? A. Inevitable abortion. B. Threatened abortion. C. Missed abortion. D. Complete abortion. Answer. Threatened abortion. Bleeding with closed cervix and live fetus indicates threatened abortion. 7. Normal range of fetal heart rate is A. 80 to 100. B. 100 to 140. Circa 110 to 160. D. 140 to 200. Answer. 110 to 160. Normal fetal heart rate ranges between 110 and 160 per minute. 8. In cervical cancer screening, which test is commonly used? A. Pap smear. B. California 125. C. Mammography. D. Colposcopy. Answer. Pap smear. Pap smear is the most common screening method. 9. A patient has polyhydramnios. Which fetal anomaly is most commonly associated? A. Spina bifida. B. Anencephaly. C. Renal agenesis. D. Congenital heart disease. Answer. Anencephaly. Defective swallowing in anencephaly causes polyhydramnios. 10. Most common site of endometriosis is A. Cervix. B. Ovary. C. Uterus. D. Vagina. Answer. Ovary. Ovaries are the most frequent site of endometriosis. 11. A woman at 30 weeks develops sudden severe breathlessness, hypotension, and cyanosis during labor. What is suspected? A. Amniotic fluid embolism. B. Pulmonary embolism. C. Eclampsia. D. Aspiration pneumonia. Answer. Amniotic fluid embolism. Sudden collapse during labor suggests amniotic fluid embolism. 12. The most dangerous complication of vesicular mole is A. Severe bleeding. B. Uterine rupture. C. Choriocarcinoma. D. Infection. Answer. Choriocarcinoma. Molar pregnancy may progress to choriocarcinoma. 13. What is the commonest presentation in labor? A. Breech. B. Shoulder. C. Vertex. D. Face. Answer. Vertex. Vertex presentation occurs in most normal deliveries. 14. A woman at 35 weeks presents with blood pressure 170 by 110, severe headache, blurred vision. What is the condition? A. Severe preeclampsia. B. Eclampsia. C. Health syndrome. D. Chronic hypertension. Answer. Severe preeclampsia. Very high BP with symptoms indicates severe preeclampsia. 15. The drug misoprostol is used for A. Treatment of infection. B. Induction of abortion. C. Treatment of hypertension. D. Relieving pain. Answer. Induction of abortion. Misoprostol is a prostaglandin used for abortion and induction. 16. What is the average weight gain during normal pregnancy? A. 5 to 6 kilograms. B. 8 to 10 kilograms. Circa 11 to 12 kilograms. D. 15 to 18 kilograms. Answer. 11 to 12 kilograms. Normal weight gain in pregnancy is about 11 to 12 kilograms. 17. Which type of pelvis is least favorable for labor? A. Gynecoid. B. Android. C. Anthropoid. D. Mixed. Answer. Android. Android pelvis is narrow and unfavorable for vaginal delivery. 18. Which is the safest contraceptive for women with heart disease? A. Oral pills. B. Copper T. C. Condoms. D. Injectable hormones. Answer. Condoms. Barrier methods are safest in cardiac patients. 19. A 45-year-old woman presents with postmenopausal bleeding. What is the first investigation? A. Hysterectomy. B. Pap smear. C. Transvaginal ultrasound. D. Chemotherapy. Answer. Transvaginal ultrasound. Endometrial thickness is first assessed by ultrasound. 20. Which is the first step in neonatal resuscitation? A. Oxygen by mask. B. Start chest compressions. C. Provide warmth. D. Intubation. Answer. Provide warmth. Initial step is always warmth and airway clearing. 21. A patient has a fibroid uterus. The most common symptom is A. Dysmenorrhea. B. Menorrhagia. C. Infertility. D. Amenorrhea. Answer. Menorrhagia. Excessive menstrual bleeding is common in fibroids. 22. A patient presents with pruritus vulvae, thick white discharge, and curdy patches. What is the diagnosis? A. Bacterial vaginosis. B. Candidiasis. C. Trichomoniasis. D. Gonorrhea. Answer. Candidiasis. Thick curdy white discharge with itching indicates candidiasis. 23. The normal frequency of uterine contractions in active labor is A. 1 in 10 minutes. B. 3 in 10 minutes. Circa 6 in 10 minutes. D. 8 in 10 minutes. Answer. 3 in 10 minutes. Normal frequency is about 3 contractions per 10 minutes. 24. A woman at 14 weeks is exposed to rubella infection. What is the risk to fetus? A. No risk. B. Congenital anomalies. C. Stillbirth only. D. Prematurity only. Answer. Congenital anomalies. Rubella infection in early pregnancy causes congenital defects. 25. Most common complication of unsafe abortion is A. Sepsis. B. Hemorrhage. C. Uterine perforation. D. Cervical injury. Answer. Sepsis. Sepsis is the leading complication of unsafe abortion. 26. Which pelvis has widest transverse diameter? A. Gynecoid. B. Android. C. Anthropoid. D. Platypaloid. Answer. Platypaloid. Platypaloid pelvis is flattened with wide transverse diameter. 27. The most common symptom of ovarian cancer is A. Abdominal bloating. B. Menorrhagia. C. Amenorrhea. D. Dysmenorrhea. Answer. Abdominal bloating. Early ovarian cancer presents with abdominal distension. 28. Which is the best method for emergency contraception? A. Oral pills. B. Copper tea within 5 days. C. Barrier method. D. Withdrawal method. Answer. Copper tea within 5 days. Copper IUD is the most effective emergency contraceptive. 29. Which factor predisposes to uterine rupture? A. Grand multiparity. B. Previous caesarean section. C. Prolonged labor. D. All of the above. Answer. All of the above. All these increase risk of rupture. 30. The normal weight of placenta at term is A. 200 grams. B. 300 grams. Circa 500 grams. D. 800 grams. Answer. 500 grams. Placenta at term weighs about 500 grams. 31. Which instrument is used to dilate cervix in gynecological procedures? A. Speculum. B. Tenaculum. C. Hager's dilator. D. Forceps. Answer. Hager's dilator. Hager's dilators are used for cervical dilatation. 32. Which hormone is secreted by syncytiotrophoblast? A. Progesterone. B. HCG. C. Estrogen. D. Oxytocin. Answer. HCG. Syncytiotrophoblast produces HCG hormone. 33. The best indicator of fetal well-being in pregnancy is A. Maternal weight gain. B. Fetal heart rate. C. Fundal height. D. Fetal movement count. Answer. Fetal movement count. Daily fetal movement count is reliable indicator. 34. The most common cause of infertility in women is A. Tubal factor. B. Ovulatory dysfunction. C. Cervical factor. D. Endometriosis. Answer. Ovulatory dysfunction. Anovulation is the commonest cause of infertility. 35. Which hormone rises significantly after menopause? A. Estrogen. B. Progesterone. C. FSH. D. HCG. Answer. FSH. Loss of ovarian function increases FSH levels. 36. First stage of labor is considered prolonged if it lasts more than A. 12 hours in prima gravida. B. 18 hours in prima gravida. Circa 8 hours in multipara. D. 20 hours in multipara. Answer. 18 hours in prima gravida. Prolonged first stage exceeds 18 hours in prima gravida. 37. Which ovarian tumor secretes estrogen? A. Dysgerminoma. B. Sertoli-Leydig cell tumor. C. Granulosa cell tumor. D. Fibroma. Answer. Granulosa cell tumor. Granulosa cell tumors produce estrogen. 38. A woman develops mastitis while breastfeeding. The nurse should advise A. Stop breastfeeding. B. Continue breastfeeding. C. Avoid feeding at night. D. Express milk only. Answer. Continue breastfeeding. Breastfeeding helps drain milk and clear infection. 39. Most common site of fertilization failure leading to infertility is A. Cervix. B. Uterus. C. Fallopian tube. D. Ovary. Answer. Fallopian tube. Tubal blockage is a common cause of infertility. 40. Which fetal presentation carries highest risk of cord prolapse? A. Vertex. B. Breech. C. Face. D. Shoulder. Answer. Shoulder. Transverse liveward shoulder presentation risks cord prolapse. 41. Which uterotonic drug is contraindicated in asthma? A. Oxytocin. B. Misoprostol. C. Carboprost. D. Ergometrine. Answer. Carboprost. Carboprost causes bronchospasm and is avoided in asthma. 42. In twin pregnancy, both fetuses are of same sex and placenta is monochorionic. What type of twins are these? A. Dizygotic. B. Monozygotic. C. Fraternal. D. Non-identical. Answer. Monozygotic. Monochorionic twins are always monozygotic. 43. Which vaccine is recommended in every pregnancy? A. Rubella. B. Tetanus toxoid. C. Measles. D. Chickenpox. Answer. Tetanus toxoid. TT vaccine is compulsory for all pregnant women. 44. The normal fetal head position in labor is A. Occipito anterior. B. Occipito posterior. C. Mento anterior. D. Brow. Answer. Occipito anterior. Occipito anterior is the most favorable position. 45. A patient develops postpartum hemorrhage. First line management is A. Bimanual uterine massage. B. Hysterectomy. C. Uterine artery ligation. D. Laparotomy. Answer. Bimanual uterine massage. Massage stimulates contraction to control bleeding. 46. Which condition is associated with polycystic ovarian syndrome? A. Hypoglycemia. B. Diabetes and infertility. C. Hypertension only. D. Hypothyroidism. Answer. Diabetes and infertility. PCOS is linked to insulin resistance and infertility. 47. The commonest site of ectopic endometrial tissue is A. Ovary. B. Cervix. C. Vagina. D. Fallopian tube. Answer. Ovary. Ovaries are the most frequent site of endometriosis. 48. Which drug is used for medical management of ectopic pregnancy? A. Methotrexate. B. Oxytocin. C. Ergometrine. D. Carboprost. Answer. Methotrexate. Methotrexate is given in stable unruptured ectopic cases. 49. A woman presents with amenorrhea, galactorrhea, and infertility. Which hormone is elevated? A. FSH. B. Prolactin. C. LH. D. Estrogen. Answer. Prolactin. Hyperprolactinemia causes galactorrhea and amenorrhea. 50. Which is the most common genital malignancy in females in India? A. Ovarian cancer. B. Endometrial cancer. C. Cervical cancer. D. Vulval cancer. Answer. Cervical cancer. Cervical cancer is the most common genital cancer in Indian women.